to keep that circulation in the brain, to give the brain oxygen and glucose that it needs. Okay. Now, let's talk about the different types of edema. So cerebral edema. So we've got vasogenic and cytotoxic. We talk about vasogenic as more blood vessel. So it's secondary to increased capillary pressure. So maybe chemical injuries from, like if someone has a blood clot in their brain and they have a stroke, we've got dead tissue. Dead tissue releases those chemicals and creates the neurotransmitters to kill more tissue. So that can cause some vasogenic edema, a sudden increase in vascular pressure beyond autoregulatory limits. This can be hypertension. This edema is localized to an area of the brain, and it has to do with being able to disrupt the blood-brain barrier. It disrupts the blood-brain barrier. And it can happen with a stroke, ischemia, and severe hypertension. People who have hypertension and maybe they don't take their meds, like they're non-compliant, and they come into the ER with a headache, and like maybe some neurological weakness, like on one side and they got a facial droop or something, then they busted some blood vessels in the brain because of the hypertension. They can have a hypertensive stroke, which is a hemorrhagic stroke, which is a bleeding stroke, which we'll talk about. So vasogenic, increased capillary pressure, and it disrupts the blood-brain barrier, and it happens a lot with severe hypertension. This is a more common thing that we see. Now, cytotoxic edema is intracellular, inside the cell of the brain edema. It occurs when ischemic cells, tissue will swell. Remember the hydrostatic swelling we see? And if it keeps swelling and swelling, it could rupture, right? So hydrostatic swelling, it's the lack of ATP, and then they can't pump the sodium out. You guys remember this? Can't pump the sodium out. So what's going to fill in the cell with all that sodium? Water follows salt, right? All that water or the fluid is going to go into the cell because there's too much sodium into the cell because it has the lack of ATP, because there's usually ischemia. Ischemia, no ATP, sodium builds up, accumulation of water, osmotic force. So this can happen in that global ischemia where like cardiac arrest. They're not getting any circulation at all to their brain, and so there's no ATP, there's no oxygen, there's no glucose, and so the entire brain swells up. All the brain cells swell up. So, cardiac arrest, severe hypoxemia, maybe a pulmonary embolus, like cardiac arrest. This is where people, did you guys ever remember, you might be a little bit too young, Terry Schiavo? Mm-hmm. She was in Florida, she lived in a nursing home like 10 minutes away from where I live. She had an eating disorder, anorexia nervosa, and her potassium got very, very low, and she passed out. And she stopped breathing. So her brain did not get oxygen. And so they did revive her, CPR was done, but the brain was already damaged. So she was total care, tube feeding, and she was all curled up in contractures, and her husband wanted to withdraw the tube feeding, bless you. The family did not, and it went all the way to President Bush, to where he was like, put the tube feeding back in. And they were like, take it out, put it in. They were constantly taking her tube feeding out and putting it back in. Finally, the president was like, I'm not doing this anymore. Husband, he was a nurse, and he withdrew the tube feeding, and she did slowly die in about 10 days. But it was because of that global ischemia when she passed out. She didn't have all that oxygen to her brain. It was a terrible debate, but anyways, yeah, it's a huge thing. Back in the early 200s, I think, yeah.
Doesn't your spouse have like a right over your medical, over your...
That was the issue, yeah. But the family didn't want that to happen. Her parents did not. So that was the fight. It went all the way to the president. So yeah, it was interesting. But anyways, we won't have that debate right now. So anyway, that's your cultural class. All right, it it does bring things up, but that's an example of global ischemia. All right, so this is a picture of vasogenic edema. We have a tumor here, and you can see this, they kind of highlighted it in pink here. That's the vasogenic edema. It's more localized. Because the tumor is probably causing some increased pressure, and then the blood is leaking out. Now, cytogenic, you can see, now this is we're looking at the top of the brain and we just sliced it like with an MRI, and we're just looking at this slice right here, but from this angle. This little bit here, it looks like the one side of a butterfly, right? This is the ventricle, and this is where the cerebral spinal fluid is made, so this is just full of cerebral spinal fluid. But this edema, you're supposed to have two wings of the butterfly. So this is squishing, it's causing edema, and we're supposed to have a straight line down here, and you see the line's like obliterated. So this edema is literally herniating the brain to this side, to the right. So that's just, it can be global, it can be localized. But it is just cellular edema, but the blood-brain barrier, BBB, blood-brain barrier is intact. This can happen with a stroke, encephalitis, and hypoxic injury like we mentioned. Questions? It's kind of a visual what they look like. All right, traumatic brain injury. Let's watch this video. Let me go back. Okay. And I'm going to pause it as we watch it so I can kind of do some teaching here.
The brain is the most complex part of the human body. This 3-pound organ is the seat of intelligence, database of memories, interpreter of the senses, and the director of all movement. Lying in its bony shell and washed by protective fluid, the brain is also the most fragile organ in the body, with the same texture and consistency as gelatin. Within the brain are over 100 billion nerve cells, called neurons, sending electrical and chemical signals to and from the body. Each neuron has a cell body, a long nerve fiber called an axon, and projections of the cell body called dendrites. Dendrites extend out from the cell body to receive messages from other nerve cells. Axons in the brain connect neurons with each other, which in turn provide extensive interconnections with other brain areas. Because the brain and its nerve cells are so fragile, sudden, rapid movements of the head can cause injuries. During one such injury, called coup contre coup, or acceleration-deceleration injury, the brain bounces back and forth against the bony interior wall of the skull. In high-speed coup contre coup injuries, the impact may be violent enough to cause swelling and bruising of the brain tissue.
So what happens in the high-speed impact, and you get that whiplash, so the front of the brain hits the skull, the back of the brain hits the skull. So you got bruising on coup contre coup on both sides. If it was a T-bone, they would go bing, bing. So then you've got bruising on either side. So we got 2 bruises here. So this is a sign of a concussion.
Called a contusion.
A contusion, sorry.
However, in cases involving low-speed coup contre coup injuries, the resulting damage may not be visible to the naked eye. As the brain moves back and forth within the skull, areas of varying density in the brain slide over each other at different speeds. Axons crossing these junctions experience tremendous shearing forces, causing them to stretch and tear from the cell body.
So that's called axonal injury or axonal shearing, as she's going to say. And this is what we were talking about with the football player. You know, they get these injuries. You saw his head just smack right down. I mean, car accidents, all this stuff. Falls, hitting head, and it just, the brain goes across the skull and it tears those axons. So imagine you're juicing an orange and the pulp all being destroyed and mushed up. That's what it kind of looks like in the brain. So you can imagine now the cells in that area can't communicate, right? So she's going to continue to explain it.
This event is called axonal shearing or diffuse axonal injury. Brain damage can continue to occur for hours or days after the initial injury. Damage to the axons can lead to a breakdown of communication among neurons in the brain. The torn axons quickly degenerate, releasing toxic levels of chemicals called neurotransmitters into the extracellular space. In turn, many of the surrounding neurons begin to die over the next 24 to 48 hours.
So remember the excitochemical reaction? That's it. Okay, because the dead ones are secreting all those neurotransmitters, causing the other cells now to die. So.
Worsening the initial effects of the injury.
Can we get those back?
Mild to moderate cases of diffuse axonal injury, or DAI, may result in symptoms such as brief loss of consciousness, impaired long-term memory, reduced problem-solving ability, lower social inhibition, and problems with attention and perception. Severe cases of diffuse axonal injury may result in coma or a persistent vegetative state.
This is like, think about, I mean, someone just bumps their head, maybe just a few of those axons are torn. Imagine shaken baby. All the brain gets torn like that. So that's why they persistent vegetative state. They need tube feedings, they need ventilators, or they'll die. They'll die. But imagine a car accident where the car rolls and rolls. And you watch these movies like Deadpool and whatever, Wolverine or whatever, and they're rolling. I'm like, they'd be dead by now. Well, they heal because they're superheroes. Anyways, but a normal person would die. Because that rolling would, I mean, it's like, just think of juice in an orange. That's what happens in the brain when a car rolls and rolls and rolls. So that's why the paramedics say, we'll ask the witnesses, and they're like, yeah, it rolled like 4 times. And they're like, ugh. And then they tell the nurses in the ER, and then hopefully the nurses tell the other nurses and the doctors, and they'll do CT scans and MRIs as well. But that's why it's good to get a report from the paramedics to find out were they wearing a seatbelt. I mean, or it got a really high speed, because you can see the, the movement of the head. Or if you have someone that's not belted, ping-ponging around in the car and banging everybody's head around. So anyways.
In the United States, over 1 million cases of mild traumatic brain injuries, including diffuse axonal injury, are reported each year. Of this number, over 300,000 patients suffer long-term effects from the damage. Computed tomography, or CT, and magnetic resonance imaging, or MRI, are tests that can be performed to check for mild traumatic brain injury. The results of these tests usually show a normal reading. Therefore, doctors must rely on patient history and a clinical exam to diagnose mild traumatic brain injury.
This is why your neuroexam is so important, because sometimes it looks normal on the CT scan until it gets really bad. So this is why you're calling the doctor if you see those trends from, like they start having seizures or vomiting or headache, you're calling, and they're going to get another CT scan and change treatment. So that's it. Okay, good. All right, let me make sure I paused it. Okay. Any questions? So that was more of a visual, and then I have the two video in there again. I think this one is more a longer video. I'm not going to show it to you. It's someone explaining that concussion. If you want to watch it on your own, it's a little bit long. It's like 11 minutes long. I'm not going to share it in class. But all right, if you're just interested. Okay. So now we're going to play a little short Kahoot, just a few questions. So let me pull up the Kahoot thing, just to kind of mix it up a bit. Just 5 questions, sign in quickly. No, I want to post live, that's what I want to do. Okay, so quickly sign up, because it's only 5 questions, it's really, really short. Okay, very good. I'll step out of the way so you can scan the thing. Turn it up just a little bit. I need the music to groove. Give you about 15 more seconds to sign on. And these will be open at noon, so you can play them again on your own. Now, the prep view, let me tell you, the prep view's been hand selected by me. It might be a little long, but they are selected, hand selected, and I'll make multiple attempts. I think there's just 1 attempt right now, but I'll make a total of 3. So you can do those questions again. All right, y'all ready? Yeah. I could try. It's just too long. Okay, I can break them down into smaller pieces. I won't do this one, I'll do the ones moving forward. Okay, let's do this.
There was a lot of them.
This edema occurs with changes within blood vessels that increase interstitial volumes. Vasogenic. It has to do with blood vessels, the disruption or breaking of the blood-brain barrier, increased pressure in the capillary system, all that terminology. Okay, questions? Okay. Eager bunny. Okay. Hyperventilation to reduce PaCO2 is likely to reduce CO2 the picture gives a clue. Vasoconstriction. So you reduce the CO2, you reduce the size of the blood vessel. That helps you remember it. Low CO2, smaller blood vessel, vasoconstriction. Is that going to cause what to the blood pressure? Increase. The brain doesn't like that. Brain doesn't like increase or decreased blood pressure. It wants normal circulation to the brain. Okay. Oh, eager bunny and an elated hamster. The brain's normal response to an increase in metabolism or a decrease in arterial perfusion pressure is to vasodilate. So it's trying to get more, now a decrease in arterial perfusion, isn't that can we say decreased blood pressure? So it's going to vasodilate, the brain's going to vasodilate to try to get more circulation in there. Okay? When the brain has increased metabolism, now the brain will have increased metabolism when it's injured, because it wants more glucose and it wants more oxygen because it's injured, so it can heal. So it's going to want more energy, so it's going to demand more when it's injured. All right. Whoa. Eager bunny and fast giraffe. They are fun to watch when they run. Normal ICP ranges from
You put that one on me, Sam.
All right, very good. 0 to 15 is normal. Very good. Okay, fabulous leopard and the eager bunny is on fire. Last one, true or false? A reduction in the volume of cerebral spinal fluid can help compensate for increased intracranial pressure. Very good. That is true, because it's going to, if there is an increase, usually the cerebral spinal fluid will just shift down to the spine. All right, so our winners are, who is the third place? The fabulous hamster. I got stickers when we're done. I got new ones. So good. Jenny and Fast Giraffe. All right. Kelly. And then, no, Julie. Kelly? Kelly, okay. And then number one, the fabulous, oh, we shifted, leopard. Oh, Janaya, nice. So at break, I've got candy and stickers. So, okay, cool. Yay. All right, okay, okay. Let's keep going. Okay, nice little break, little breather there. Now, let's talk about the different types of hematomas. So, we're going to start with the epidural hematoma, epidural, on top of the dura. So if you look at your brain here, the dura is that thick, tight, not thick, but really fibrous, tight layer that sits right on top of the brain, right? Now this bleed is on top of that layer, that dura, epidural, on top of. And it usually results from someone hitting their head, and usually the temporal area, and it tears that temporal artery. It tears the temporal artery. So is the artery going to bleed more than a venous bleed?
Yes.
Yes. This is going to bleed and bleed and bleed and bleed and bleed and bleed and bleed very quickly. So you can see in this epidural hematoma, it's pushing the brain over, right? Look, the ventricles, these are the ventricles are being squished over, right? So, and the artery has been torn, and they're going to bleed quickly, and they can die quickly. This is, I mean, all the head injuries are emergencies, but this is more of an emergency. It's arterial in origin. Usually the person will, like maybe, it's happened to Liam Neeson's wife. I forget her name. They were snow skiing, and she hit her head, and then she passed out. She hit her head, passed out, and then they wake up and they have a lucid moment. So they'll have a brief period of unconsciousness followed by a lucid moment. So she came to, paramedic showed up. She said, I'm fine, I'm fine, I'm fine. She was alert and oriented, moved everything normally. Everything was normal. She said, no, I'm fine. And they were like, okay. They shouldn't have done that. They should have just take everybody who bumps their head to the ER. Did anybody remember that nursery rhyme? Something about he bumped his head and went to bed and didn't wake up in the morning. That's what happened to her.
It's raining.
So she ended up having an epidural bleed because she had this, her assessment was normal, but very, very quickly she fell asleep and didn't wake up. She bled because it's arterial. I've said it like 3 or 4 times now. Arterial, she bled and bled and bled and bled and bled to the point where she cut off the circulation to her brain and she died. So these epidural bleeds, if they come to the ER, the trauma surgeon will remove that blood, do a little craniotomy, and they do very well. Because they do very, very well if they come to the ER and they get seen. if I'm on the side of the road and somebody fell over and bumped their head like a cyclist or something, I'm like, we're calling 911. I don't play. They're like, no. Nope. I'm calling 911. You can refuse, but I'm calling. Okay. Because I want you to live. I'm sure your family members do too. So anyways, that's the epidural. Okay, and then we're going to talk about something called the subdural. So sub, under the dura. So let's go to the next one, the subdural. So there's a dura, so it's under the dura. Now, this is, of course, head injuries, people who are alcoholic, and older adults with atrophy to the brain. This is a venous bleed. So these people bump their heads, and alcoholics have very fragile, their brain, they have encephalopathy, and they don't have good blood vessels, and elderly as well. These venous blood vessels will break, and this is where the venous blood is in this area, and so they bleed in that subdural space underneath the dura. Now, because it's venous, is this going to bleed fast or slow? Slower, right? Now, of course, they need to be removed, and you're going to learn about how the surgeon does that. But again, if it gets really big, it can push, herniate the brain over. Now, this can happen in car accidents. They fall down, hit their head. But it seems to happen more with older people and alcoholics who fall down and hit their head. So it's venous. It bleeds slower. And acute subdural hematomas can progress rapidly and have a high mortality rate because of the severe secondary injuries of edema and increased ICP, which we already went over. The edema and the increased ICP. So if someone, a traumatic head injury, they can develop faster, but they're not going to be as quick as an epidural. Yeah.
So you said that alcoholics and old people is more common. Is it because when they fall, they're impaired, so they're not catching themselves and they're getting the full blunt?
They're getting the full blunt, but also because of the chronic alcohol and then the atrophy of the brain, these blood vessels are fragile and they'll bust open. They're a little bit more fragile. So this is venous bleed. Now the signs and symptoms, just see your increased intracranial pressure slide that we talked about earlier, the early and late signs. So the signs and symptoms we pretty much already covered. Now because let's say the bleed's on the left side, where are they going to have their weakness? The right. If the bleed's on the left, they're going to have weakness on the, I just did it opposite, but you got it's going to be opposite. But we'll have the change in level of consciousness, vomiting, seizures, weakness, all that kind of stuff, right? The same symptoms will be the ICP. Now, the next one is just a intracerebral. So right here, intracerebral bleed. And again, because older adults and alcoholics have more fragile blood vessels, they can bleed here after a fall. It's due to severe motion the brain undergoes during head injury. So we saw how the brain will move. And again, it's like gelatin, right? And as it moves, it can tear those blood vessels. Frontal and temporal lobes, it can be in the frontal lobe because they've hit their head right here, or temporal lobe because they've hit their head on the side. And the signs and symptoms are just increased intracranial pressure. Just go back to that slide. All right. And again, they'll do CT scans and MRIs and see the bleeding. And the neurosurgeon will take them to surgery. All right. So, any questions on those three types of bleeds? Epidural, subdural, intracranial. Epidural is what type of blood vessel bleed? Artery. Subdural is venous. Good. All right. So let's talk about, any questions? Yeah.
So those two are artery and vein. Is this one just like?
The intracerebral is usually artery. It can be, usually. Okay, so cerebral circulation. So we talked about earlier, we've got our carotids, we've got a right and left internal carotid that go to our brain, and then we have our two vertebrals right back here that are in our, literal vertebrals, and they go into the brain. So we've got our foramen magnum, which is that hole, and they go into, and again, if there's herniation, that area gets pinched off and patient becomes brain dead because of that. Cerebral vascular disease can encompass a number of disorders involving vessels in the cerebral circulation. We can have a transient ischemic attacks and strokes. So we're going to talk about those. And let's look at, now this is if we had a camera looking at the base of the brain. And so we're just looking at the base of the brain. So this would be the spinal cord right here. So going, as if they're laying down and we're looking at them and their spinal cord's going like that. This circulation here is called the Circle of Willis. The Circle of Willis. And I have a neuro nurse that has this tattooed on her back in the form of Celtic knots. She's so nerdy. Anyway, she was like, you want to see my Circle of Willis? I was like, oh, gee. Okay, that is so creative though. That was pretty cool. But it was all Celtic knotty. Anyways, does it look like a little alien with antennas, right? The Circle of Willis. You do not have to memorize all the blood vessels. I just want you to know the Circle of Willis, it's an artery, they're arteries, and they give the blood and the oxygen to the brain, right? See, these are the vertebral arteries, and these are the, that's the base, and they merge into the basilar artery, and these are, they're different arteries, you don't have to name them. The big thing I need you to connect with, and we'll get to this later, these little intersections where there's like right angles here, aneurysms can form. Remember you guys learned about abdominal aneurysms, and she touched on a little bit of cerebral aneurysms. So the cerebral aneurysms, they like to form in the bifurcations or the little angles there because that's where they're weak. And I just want you to take this with you when we get to that point where we're talking about aneurysms and ruptured aneurysms. Because the patient will have what? Thunderclap headache, right? They'll just suddenly get a headache. Those of you who suffer from migraines, you're usually like, oh, I feel a migraine coming on, it's slow. This is, bam, they have the worst headache of their life. Someone comes in the ER with the worst headache of their life, take them back right away. They need to be looked at. They're having, this is an arterial bleed. They can die very quickly, right? This is what happened to my niece. And she sat in the ER for 6 hours. Because she had ptosis, which is the drooping of the eyelid, and she said, I think I have a sinus headache. She's a redhead. Very low pain tolerance, high pain tolerance. So she didn't say worst headache. And they sent her home with sinus meds, and she proceeded to, vomit and have a seizure. And she was pretty devastated after that. She didn't really recover very well. And my sister won the lawsuit. So anyways, but she was total care for 4.5 years when she did pass away. So it was awful. Awful. So, but yeah, it's been a long time, so I can say it without crying. So yeah. Anyway, so anybody that comes in with a bad headache or any kind of cranial nerve deficits, take them back right away. All right, so let's talk about the pathogenesis and regulation of cerebral blood flow. We just saw the blood flow, reviewed our AMP. It's controlled by autoregulation, the ability of the brain to maintain a consistent blood flow. It's the brain will do things to maintain its blood flow. It wants the map, now here's different numbers, 60 to 140, we saw 70 to 100, but 60 to 140, if it's less than 60, if the map is less than 60, the blood flow is going to be compromised. So hypertension is going to stretch those vessels and cause what type of edema? Vasogenic. So blood vessels, vasogenic. So, and like I said, if the metabolic needs of the brain are higher because of head injury, this is going to be more demanding. So we got carbon dioxide. Remember, we've got increased CO2, increased blood vessels. So vasodilatation. Low CO2, we've got smaller or blood vessels, so vasoconstriction. If we've got acidosis, we have increased blood circulation. If we've got low oxygen, which is hypoxemia or hypoxia, increased cerebral blood flow. Because the brain is sensing low oxygen, so it's going to increase the blood flow. So What is happening in all three of these situations? Increased CO2, acidosis, and low O2. Compensation, yeah. We see basic vasodilatation is going to increase blood flow. So we have the brain saying, I need more blood, I need more oxygen, increased blood flow. We see a lot of increased blood flow here. I need more oxygen, I need more glucose. So we will see these things happening. And this is like why we usually put our really bad head injuries on the ventilator so we can keep that CO2 normal. We keep it normal, okay? So, and we keep the blood pressure normal. We keep the oxygen within normal range. We can control that on the ventilator. We can control it with meds. But, okay. But this is just your pathogenesis here of what's going on. Now, Cushing's triad, odd enough, is not really in your book. You're going to learn it in Med-Surg, and I really wanted to make sure you understood it. Now, massive increased ICP, and you can see the ICP is higher than the mean arterial pressure. So what's that telling you? The brain is pushing down, but the blood pressure can't get up. The blood can't get through. So the brain just herniates down that foramen magnum, pinching off circulation. So we're going to see a massive increase in blood pressure. So, and the blood pressure is going to be wide. It might be 250 over like 60. It's going to be a very, very high systolic and a very, very low diastolic. Because the brain, the maintaining cells of the brainstem are saying, heart, come on, you can do it, pump it up, get it up there. But the heart rate is low because the brainstem's being squished, and that's what controls the heart rate. So we have bradycardia and this irregular respiratory rate. So usually by now, the patient's on the ventilator. So this tells us that the patient is actually in the process of possibly dying because the brain is so swollen. I've seen it when, the patient's been there for 3 days, we've done everything. Patient's gone to surgery, we've given all kinds of medication to shrink the swelling, and you can't touch these patients. The minute you touch them, their ICP goes up. So you're standing, this is your patient, you're standing at the foot of the bed like this. Good, I've done everything. He's sitting up. And I've walked in at change of shift going, oh, I wonder how that 19-year-old boy's doing. They got hit by a car. 2 days later, I come in and the nurse is like, tears rolling. I was like, no, what's happening? And I look at the monitor and I see bradycardia, hypertension, patient's on the bed. And I'm like, no, we worked so hard on him. So it's really hard. So sometimes they get better. So yeah.
So is it like this one is the chance spot?
Yeah, they can have chain Stokes if they're not on the ventilator. Yeah, if they're not on the ventilator. They would have chain Stokes or like really irregular breathing, periods of apnea, stuff like that. Yes, Taylor, you just stretching?
Yes.
Stretching, okay, good. All right. So, let's play just one Kahoot and then we'll take a quick break. Just breaking it up. So part 2. Again, just a really short little Kahoot. Give you about 15 more seconds to sign on. Okay, y'all ready? Yeah. Here we go. The earliest indicator of compromised neurological functioning is usually Level of consciousness, that's gonna be the first thing you see. The first thing you see. They'll either be sleepy or really restless and mean. I had one spit on me in the neuro unit. Didn't we? He got mad, then he had a seizure. Anyways. The Glasgow Coma Scale has 3 measures of coma that include all the following except. Good. It's just, it has motor, eye, and verbal. Those are the only things we test on the Glasgow Coma Scale. Pupillary response is just its own thing, its own assessment. Okay. Ooh, polite lemming. I like to move it. Okay, which of the following responses represents the worst neurological status? Good. That decorticate to the core, yeah, the arms are going to the core, so good. That tells us we have brain stem involvement. The awesome urchin. The pupil response to light tests the functioning of cranial nerve. Remember, they're in Roman numerals. Okay, so it is 3, but cranial nerve 2 senses the light, and cranial nerve 3 motor responses to that light. It should constrict briskly. So cranial nerve literally sees the light, it senses the light, and then the pupil will constrict to light. So it's 2 and 3. All right. A smart sea lion. True or false? A decreased level of consciousness is synonymous with a state of unconsciousness. The aim I must have put this picture in. I didn't put this picture. It doesn't make any sense. Right. The decreased level of consciousness is synonymous with the state of unconsciousness is just coma. Decreased level of consciousness is just confusion, stuff like that. Like they think they're at Disney World instead of at home or whatever, right? Or they think the date's wrong, okay? Or they're saying, you know, there's somebody else, the wrong name, okay? So level of consciousness just means they're confused. Unconsciousness is, blink, they're not with us. They're out of it. They're unconscious. All right. So you can get 1 sticker or 1 piece of candy, the rapid lemur. All right, Henry. And then the awesome urchin. All right, Emily. And then the smart sea lion. Nobody wants to claim it? Oh, good. So I'll bring out the candy and stickers. You guys can look at them as the previous winners. We'll take a 10-minute break. Come back at 11:02.